Hi, I'm Dr. Ramashia. Welcome to another episode of #Knifed. In today's episode, we'll be taking a look at two cases from the emergency department. We'll also play a game called Fact or Fiction. And finally, I will give a few tips on a very common disease in the South African setting. Case number 1. A 4-year-old girl was brought into the emergency department by her mother. The history the mother gave is that the girl was extremely tired and refusing to play with other children. What was most concerning to us, however, was that the girl was extremely pale. Following diagnosis and emergency management, she was admitted into the high care unit. Case number 2. I found this one a little bit out of the ordinary because, let's be honest, South African men tend not to be your typical health seekers, but nonetheless. Case 2 is a 38-year-old gentleman who was referred to us by a local clinic. Apparently he had not been feeling well for about 10 days now and went to the clinic complaining of what he thought was a simple flu. What concerned the clinic though was that he had a very high fever of 39 degrees. Normal is below 37.4. So they decided to send him. The clue in diagnosing this man is that he works as a truck driver and had recently traveled to Mozambique. We tested him, diagnosed him, gave him treatment, and sent him home. So what's the diagnosis? If you haven't guessed by now, both these patients had malaria. So it turns out that case number 2 is actually the father of case number 1. This gentleman traveled to an area that has a high prevalence of malaria. He was bitten by a mosquito and came back with signs and symptoms of what we call a simple, uncomplicated malaria, the kind that can be treated in a clinic with tablets. His daughter, however, suffered from what we call an Odessian malaria, which means she was bitten in a non-endemic area by a malaria-bearing mosquito. The mosquito could have traveled perhaps in the man's baggage or in his clothing. She ended up having signs and symptoms of what we call a complicated malaria, symptoms I'll mention in a later video. Her particular symptom of interest, though, was that she was very pale. Fiction. Anyone can get malaria provided you're bitten by the right kind of mosquito. Fiction. So, the only mosquito that can transmit malaria is what's called the Anopheles mosquito. Specifically, it's only the female Anopheles mosquito that can transmit malaria. Men, you know, they often say that there's no wrath than that of a woman, something like that. Well, this is very true in the case of the female Anopheles and malaria. This is true. So the initial symptoms of malaria tend to come about 7 days after being bitten by the Anopheles mosquito. And the first symptoms can just feel like a really bad flu. So the first thing is a fever, and then one can have flu-like symptoms, muscle pain, joint pain, feeling like there's a cloud on top of you, feeling very heavy, and one can misdiagnose it or mistake it for a simple flu. The red flag signs to look out for will go from top to toe. There's 5. There's more, but let's say 5 for now. Head, eyes, lungs, urine. Head, if a person becomes very confused or falls into a coma. Eyes, if your eyes turn yellow, or if the flesh of your eyes become very pale. Lungs, if you become very short of breath, and urine, if it becomes very dark. Red flags, go to the hospital. Your 3 take-home tips are as follows. Number 1, be aware. Malaria does exist and can affect anyone. So know that it's out there so that if you do get it, it can be treated. Number 2, prevention. If you know that you'll be traveling to a country in sub-Saharan Africa or a country that's known to have a high prevalence of malaria, make sure you take what we call prophylaxis. This is just a fancy medical term for preventable. This will make sure that if you do get bitten by the notorious mosquito, it'll prevent you from getting the disease. Number 3, early recognition and early treatment. So if you have traveled to one of these notorious countries and come back just not feeling yourself, it might be something as simple as simple flu symptoms or any of the complicated symptoms I mentioned in the previous stories. Make sure you go get tested. The test for malaria is a simple finger prick and takes 20 minutes to read. Within that time, you can get a result and get early treatment. That's it for this week's episode. Thank you so much for watching. Hit the like button if you enjoyed it, drop us a comment, and remember to subscribe if you want more content. If you'd like to engage with me further, my Instagram handle is @thedoctorondex. But until next time, you have been knifed.